Hi, I'm Lindsey Smith, welcoming you to Raise the Line from Elsevier, an ongoing exploration about how to improve health and healthcare. The latest nursing workforce data shows that only 30% of registered nurses are Black, Hispanic, or Asian, even though racial and ethnic minorities will soon comprise more than half of the U.S. population. Closing that gap is just one of the pressing challenges facing nursing today, and a focus of our guest, Dr. Ernest Grant, Vice Dean for Diversity, Equity, Inclusion, and Belonging at the Duke University School of Nursing. Dr. Grant brings more than 30 years of nursing experience to his work, including internationally recognized expertise in burn care and fire safety. He is the past president of the American Nurses Association and was the first man to serve in that role in the ANA's history. Among other honors, he's previously been recognized by Modern Healthcare magazine as one of the 50 most influential clinical executives and 100 most influential people in healthcare. Today, we'll talk about the state of nursing, including workforce issues, nursing education, equity, and what the profession needs to move forward. Thank you so much for joining us today, Dr. Grant.
Thank you for having me, and delighted to be here.
I'd love to start right at the beginning. Can you take us back and tell us what first drew you to nursing? And then secondly, how did you end up in something as specialized and as intense as burn care?
Well, actually, I like to tell people nursing found me. When I was a junior in high school, I wanted to be an anesthesiologist, but I was the youngest of 7 kids from a very poor family in rural mountains of North Carolina. And my high school guidance counselor suggested that maybe I'd like to consider becoming a nurse anesthetist, because back then there was very few scholarships available to go to medical school and et cetera. So he suggested, well, why don't you go to nursing school, become a nurse anesthetist, and then if you still wanted to go to medical school, it's a roundabout way to do it, but you could certainly do it. And I said, okay, that seemed like a good idea. And I went to the local community college, enrolled in a licensed practical nurse program. And within 3 months of that program, I realized that nursing was my calling, totally forgot about medical school, but realized also that the scope of practice for the LPN was very limited, and I wanted to be able to do more for the people that I cared for. So subsequently started working on my baccalaureate degree, and I guess you could say the rest is history.
I love what you said there, that nursing found you and that you found that moment of calling clicks into place. We've heard from many previous guests that even if their career started bedside, it sometimes doesn't always stay there forever. And at some point, you also stepped into leadership. I'm curious if you can tell me about that.
Certainly. Sometimes people see leadership skills in you that you don't see yourself. And maybe it takes a knock upside the head before you finally realize that. I think my leadership journey started in my baccalaureate program, and that my professors always drilled into the class just about every day, at least 2 or 3 times a week, that one, if you're going to consider yourself to be a professional nurse, you need to join your professional organization. And like a lot of students, I'm sure they were probably told, okay, you'll get extra points for this course that you're taking. If you're taking a leadership course, if you go to the local State Nurses Association meeting, either the annual meeting or if there was a district meeting, and et cetera. And that was the case for me. We were assigned to go to several district meetings of our State Nurses Association. But it wasn't just to be there and see how things were done. My professors were there as well, and they weren't there just to check, okay, this student's here, this student's there. They were pretty much showing us the pathway. They were chairing committees. They were getting up to the microphone, asking those very challenging questions. And the same thing also when we went to the annual meeting of the State Nurses Convention as well. So it was sort of a no-brainer that when you graduated, you got your diploma in one hand and you got an application to the State Nurses Association in the other. And so probably about 10 days after getting my baccalaureate degree, I submitted my application to join the North Carolina Nurses Association. And right after that, they reached out and said, well, we have some committees if you'd like to do that. Well, already hearing the ghost voices of my professor saying, if you're going to consider yourself a professional, join your professional organization. So I started out on the membership committee and did very well with that. And next thing I know, they were tapping me on the shoulder oh, you ought to run for president or you ought to run for, and I'm like, no. But eventually it got there. But then also my employer also put me on several committees of which I was, was chosen to lead those as well. So I think it was a combination of both of those that led me into doing that. In my current role, one of the things I tell my students is that it's, pretty much the same thing my professors told me. If you're going to consider yourself to be a professional, join your professional organization. And I add to that the caveat that it's one thing to have your name on the roll. It's another thing to be an active member. So I encourage them to, that you need to be an active member, have a say in how the profession is practiced and governed, because if you don't do it, someone who's far removed from nursing is going to do it.
I'm glad you mentioned associations there and how it all got started. Let's jump to 2018, when you stepped onto a national stage in a way that no one before you ever had. You made history as the first man elected president of the American Nurses Association. What did that moment actually feel like for you? And what do you think it said about where the profession was headed?
Well, it's a day that will definitely live in infamy for me. It was I distinctly remember it was June 18th, 3:30 in the afternoon when they announced the election results. And it was one of those you had to take a moment to let it sink in. And when it did, it was like, oh my God, I have broken the glass ceiling, made history. One of the first things that I did was to call one of my mentors, whose name was Dr. Gene Tranbarger. I remember him saying, well, be careful what you wish for because it will come true. But he had been a mentor of mine for years. What it meant, though, was recognizing that one, all eyes were going to be on you because you were really going to be under the microscope at that time, that, people were perhaps maybe waiting for you to either make a mistake or look at your leadership abilities. One of the things that I had strategically done before choosing to run for president of ANA was that I had been in other leadership positions in other organizations that were smaller than ANA and that were outside of nursing, but I did not want people to say, well, as I put it, yeah, but, he's nice, but yeah, but he doesn't have this, he doesn't have that. Whereas I did have leadership experience serving on several boards and also being chairman of a very large organization as well. So, having those really helped me as far as with my leadership within ANA as well. And plus, having served on the ANA board 4 years before also seeded things very well too, because I was very aware of what was going on in the nursing profession at that time and where it needed to, or where I thought it needed to go by the time I had became president.
I'd imagine that moments like that June 18th date carry so much and also become a signal to everyone else watching maybe what's possible. So representation is exactly where I want to go next. We open today with a striking number that only about 30% of registered nurses are Black, Hispanic, or Asian, even as the country grows more diverse. I wanted to dig into why that gap matters. Beyond the obvious questions of equity and fairness, why does that diversity gap matter for the actual quality of care patients receive?
Well, that gap matters because I'm a firm believer that nursing should be representative of the people that we serve. So if, as we're seeing the population of minority or ethnic minorities increasing within the United States, then the same should be that trickle-down effect to not only the nursing profession, but other professions within healthcare as well. Physicians, pharmacists, respiratory therapists, physical therapists. We know, studies have shown that particularly in the nursing realm of things, that you get a patient who is more compliant when they see someone who looks like them, who can advocate on their behalf, that is from their culture, that perhaps can have that conversation with members of the healthcare team that, this is how our culture views health and healthcare. It helps to broaden that thinking. And when we think about culturally competent care, that's one of the things that you want to ensure. Also, it helps to reduce the lack of trust that a lot of ethnic minority populations have when it comes to health and healthcare. So it's extremely important that we do everything we can to open opportunities for people from underrepresented populations to have that opportunity to become members of the healthcare team and promote health in so many different ways. You could do it from the preventive way. It's great to know that people are in the acute care setting, but what I really like to champion is why wait until there's that need for them to be in the acute care setting when we can be out there before that, preventing these injuries, doing education, and taking into account individuals' cultures and things like that and understand that so that we can do the education that is necessary to keep that individual in the community healthy instead of waiting until there's that acute need. It's nice that the acute care need is there, but if we can do something to prevent that from occurring to begin with, think of all the dollars that we're saving from a healthcare perspective, but also, again, the building of the trust of the community as well.
Absolutely. That connection between who's delivering the care and how well that care actually lands makes so much sense when you talk about it. But it's still sadly something that we don't always see consistently in practice, and it's central to the work that you're doing as well. So let's talk about Duke. Now, Duke is famous for basketball and also one of my favorite teams. Of course, I have to mention that. But it is also, and more importantly, home to one of the very best nursing schools in the country, consistently ranked in the top handful nationally. Tell us about your role at Duke and what does your work look like day to day?
Well, my work here at Duke, I am an associate professor and also the vice dean for diversity, equity, inclusion, and belonging. So again, that comment that I made earlier about nursing needing to be reflective of the people that we serve, I am here for everyone, regardless of their ethnicity. But it is nice that people from underrepresented cultures come into our program. They know that it is a welcoming place. It's a place where they belong. And that's one of the things that my office is responsible for, is to ensure that everyone, when they walk through those doors, feel that they belong at the Duke University School of Nursing, or Doosan as we lovingly call it. Other parts of my role is obviously I actively teach across all levels of the programs, either leadership or, foundation or health policy. So using my experience as president of the American Nurses Association, again, stressing to students the importance of being involved and why decisions that are made either in Washington, D.C. or in our state capital here in Raleigh, or even locally, how that may affect your ability to practice, whether you're a nurse at the bedside or if you're in the advanced practice role, and et cetera. So it's important that nurses become very politically astute and to recognize that sometimes decisions that are being made will affect their ability to practice. So they need to pay attention to what is going on and go to town hall meetings, either as a nurse or even as a concerned citizen, and let it be known that I am a nurse, and this is how this piece of legislation may affect me as a member of the community or me as a professional in the people that I care for. When we're talking about either air pollution, water pollution, or various other things that are in our environment that may affect us as well. We know that nursing is the most trusted profession. So when people in the community see that a nurse is speaking up about an issue, that really rings home the importance of what we can bring to the table and have our voices heard. So again, just trying to get students to understand all of that as well.
That's such important work and truly helped shape a profession for years to come. Let's come back to something you mentioned about part of your role. DEI programs have come under serious political pressure in the recent years. How are you navigating that environment?
As you heard, I still use the title. The title of my office is still Diversity, Equity, Inclusion, and Belonging. My dean and I had some conversations when it was, I guess you say, not the thing to use that. But we firmly believe, though, that is part of our mission statement here, is to promote diversity and inclusion. And really, when you think about it, people may use other words such as underrepresented, minorities and things of this sort, but it's giving everyone a chance to, if they want to become a nurse, what are the opportunities that we can do to help that individual? And part of it also is educating the public. When people hear the words diversity, equity, and inclusion, they automatically perhaps associate it with a negative term or with a certain population. So again, it's a matter of educating the public that when we say diversity, equity, and inclusion, this is what we're talking about. And it's not necessarily referring to one ethnicity or whatever, but is the playing field level for everyone who wants to walk through these doors and become a nurse or an advanced practice nurse. Those are some of the things you have to, I guess, some of those workarounds, or at least try to educate and get people to understand what we're talking about when we use those words.
Thank you for sharing that. I think that education piece is really important. Let's talk about how nurses themselves are treated within the profession. You've been nationally recognized for confronting racism within nursing itself and how nurses are treated, supported, and advanced professionally. What does that work actually look like in practice?
If you don't mind, I'd like to take the reverse of that. This year, actually, 2026 is my 50th year being a nurse. So when I started in nursing as a licensed practical nurse back in 1976, I think the amount of men within the profession was maybe 3%. The number of Black men within the profession was even less than that. So to come up to, I think now, again, as you pointed out, nurses of color is roughly about 30% of the population. Men in the profession, depending on who you read, is about 15%. But again, African American men, less than that. We're making progress, but we also have a very, very long way to go. Some of the challenges, obviously, in some cases, I have been challenged as to my education. Sometimes you walk into a room and another nurse may ask you, "Oh, are you a nurse?" After you tell them, and they go, "Oh, what school did you go to?" As if that's going to determine whether or not you are a good nurse or you meet their standard of a nurse. And my comeback to that is, what really determines if you're going to be a nurse, one, it may or may not be where you went to school, but the NCLEX exam, right? Because if you pass that, that levels the playing field. But some people just automatically sometimes will have these prejudices built up. Some of the other challenges is, well, one being, your audience may not see me, but I am 6'6", and I recognize what an imposing figure I can be. So when you walk into a patient's room, sometimes there's that fear factor. When I was taking care of burn individuals, they were thinking, "Oh, this guy's going to kill me," or whatever. And little did they know that I was actually as gentle as a lamb. But I also know that I can use my height and stature to help promote either policy change or to call attention to a matter that sometimes my female colleagues may not be able to, or to have people, really pay attention. So it's important that nurses have that seat at the table where policies and decisions are being made. One of the things I always ask those in administration is, did you ask the end user? When they're making decisions, yes, it may seem easy and logical from their perspective, but the person that really matters is the end user. That nurse who's at the bedside. Does it mean that, yeah, it's nice to have the electronic record or something to add to the electronic health record, but does it mean now that I'm going to spend more time addressing that issue as opposed to being able to physically do physical hands-on with the patient or be there with the patient? Because we all know that if it's not documented, it wasn't done. And then, the payers may say, well, we're not going to pay you for it because it's not there. And I understand that there's the need for that, but those are just some of the things and the challenges that nurses may face as we embrace more technology. And I'm all for that, but is that putting us further away from the patient? Also, the burnout that nurses are facing, and as well as in some cases, verbal abuse and even physical abuse as well. And what can we do to address those issues? We do have posters that say, this is a place that will not tolerate that kind of actions and such. But in some cases, I've been told where if a nurse chose to file a complaint against a patient or a patient family or even one of their colleagues who may have lashed out at them, they're discouraged from doing that. So why have the policy if you're not going to enforce it? And again, what that says to that nurse, says a lot as well, that, how much they may or may not be valued. really speaks volumes there as well. So there's a lot of challenges that we as nurses face. And again, part of that is the need to have our voices heard and to make certain that people understand where we may be coming from, not only as an individual, but also as a profession.
First of all, congratulations on that impressive nursing milestone that you mentioned. And thank you for walking us through what it takes to do this work and for also acknowledging that nurses need a seat at the table. I want to come back to something you mentioned about burnout because our very own Clinician of the Future report focused on nursing this year and really drove home that exact thought. 34% of nurses surveyed told us exhaustion had actually impaired their ability to treat patients effectively. And they pointed to high patient volumes, excessive administrative work, and staffing shortages as big drivers. So thank you for mentioning that. Some of the other barriers show up even earlier, before nurses ever reach the workforce, back in the classroom. So I want to talk about nursing faculty a little bit. There's been a persistent shortage of nursing faculty that has hampered efforts to grow the workforce because you can't train more nurses without enough people to teach them. How are you guys thinking about this at Duke, and what's happening more broadly to address this?
Well, one of the things we're doing, we had nurse faculty loans where for nurses who may have, or nursing instructors, or people who want to become nursing instructors nationwide, you have to have a master's in, nursing education. So, having a nurse faculty loan that would encourage people perhaps who want to transition maybe from the bedside into education, but maybe financially they're unable to do that. Those nurse faculty loans are one of the ways that we can help to bridge that gap and get more people to come into the profession of teaching that way. Also, if they use the same thing, if they want to earn their doctorate of nursing practice or even their PhD, it opens up the opportunity there also. Other things, just obviously increasing salaries for professors. It's odd that in some cases, the individual that you're teaching, the moment they graduate and pass boards and get employed, they're going to be making more than what the professor is going to be making. It's not just in nursing, it's in other professions as well. But obviously, one of the ways to do that is to make it more competitive and to increase the salaries for people who are considering coming into the nursing profession. Other things as well, offering more continuing education opportunities and things of this sort, and drawing attention to that. Just recently, as well, as I'm sure your audience is aware, that the Department of Education and their ruling about professions and not seeing either nursing or advanced practice nursing as a profession. Again, that goes back to that what we just talked about as well, but it's certainly part of that is limiting the funds or the amount of money that someone may want to borrow if they do want to come back to school to become a nursing instructor or to get their DNP. They're going to be limited with how much money they can borrow. And what that does is it forces them to go and get a loan from maybe a commercial loan or something, which may have a higher interest. And so they're going to be weighing the option. Do I want to, do this, or can I get a loan at maybe from a federal loan at maybe 6%, but then, going to one of the other commercial lenders and the interest rate may be 10% or higher. And that may mean several more years paying off that loan, as opposed to with a lot of federal loans, they can be forgiven if the individual works in an underserved community. So those are some of the things that they have to weigh. But yes, recognizing that nursing faculty are aging out. And so trying to get more opportunities for, people to come into the profession, because as you mentioned, you're not going to be able to turn out more students to fill the huge gap or shortage that we have unless you have enough instructors, not only in the classroom, but also in the clinical setting as well. So there's a need all the way around. And a lot of times, cultivating those who serve as clinical instructors. They're excellent individuals, and cultivating them to perhaps want to come over and work, within the classroom as well. There's another option to try to get more faculty in various schools and colleges of nursing.
It's great to hear the pathways and opportunities that you outlined that are available for nursing instructors moving forward. I want to talk a little bit about Elsevier. So we are an education company at heart, and we're always looking for gaps. and how we can fill those knowledge gaps. So I have to ask, is there a topic in healthcare you think deserves more attention?
Yes, absolutely. I think nursing and/or nursing pathways. We have those pathways where, maybe a high school student who wants to be a nurse and, they take some advanced courses and et cetera. But to me, it needs to start earlier. It needs to start in elementary school. And, one of the things that I had planned to do when I was president of ANA was working with the Boys and Girls Club to encourage them to invite nurses in to their meetings and nurses from all representation to talk about what nursing is, that we take the same STEM courses as somebody who's going to be, a physician or a pharmacist or a rocket scientist or whatever, but here are all the cool things it is to what it means to be a nurse. Another organization that I belong to, we actually have adopted a third grade here in Durham. And, once or twice a month, we go in and help tutor those kids in reading and in math. So hopefully when that student thinks about what profession they'd like to go into, they may think, hey, it was a nurse that taught me how to read. It was a nurse that helped me with math and et cetera. And we get the opportunity to talk to them about a career in nursing so that they understand I need to pay attention to the science and, be very strong in that. And that you don't necessarily have to work the bedside. Nurses are everywhere. You could be in the community. I know nurses who work with NASA, nurses who own their own business. So, again, letting people know all the various roles and places where nurses are, that is one gap. I think another gap is, of course, trying to get the public to understand science and how that contributes or help us to remain healthy or promote a healthy lifestyle, if you will, for us. Right now, the country seems to be turning its back on that, but we really need to reinforce, look at all the advancements that we have made because of science and how we've been able to tackle diseases and illnesses and things like that. That happened as a result of science and research. And so we really need to try to get the country to focus back on the importance of recognizing and appreciating the work that scientists bring to the table and how that helps to promote our health and safety and well-being.
Those are two great suggestions, highlighting nursing pathways and understanding science for the general public. Both of those make a lot of sense. And I loved what you talked about there with the nursing tutoring program. I think that's an incredible idea. So let's turn our attention to the people listening, because we have a lot of students and early career professionals in our audience. What's your advice to them about meeting the challenges of this moment and building a lasting career in healthcare?
Well, first of all, sometimes they may get burnt out, but let them know that there is light at the end of the tunnel. And it is very important that they stay strong, recognize that there are resources available for them when they feel that they've hit a brick wall, that do not give up. You're not experiencing anything that anyone else who blazed a trail before you has done. If anything, those who went before you made it a little bit easier for you. So don't give up from that perspective. The other thing, too, is to recognize that you as an individual are going to make a huge contribution to not only the profession that you may be choosing, either, if it's medicine, nursing, pharmacy, whatever, you are going to make, as an individual, is going to make a huge contribution to that. And as a result of that as well, even from a microscopic level, the community that you're in or the state that you're in, or even the whole country, you're going to make a significant difference. And so, there are going to be those days when you feel that, why am I doing this? And et cetera. And all it's going to take perhaps is that one person to come back and remember to say thank you, or something that you did either in research or whatever else is going to make a significant difference. Just think, if you had stopped, that difference would not have been made. So try to maintain a very positive attitude. One of the things I do and have done every day for the last 50 years of my career as a nurse is to ask myself one question, and that is, did I make a difference today? And undoubtedly, I can always say yes, no matter what role I may have been in, either at the bedside or leading a national organization or in my current role as a vice dean educating tomorrow's professionals. Yes, I can honestly say that, yes, I did make a difference today in someone's life or within the profession, or, that will eventually affect someone's life. So I hope they would take on that attitude and realize the important role that each of us play as a part of the human race.
You certainly are making a big difference. Before we wrap up today's episode, is there anything we didn't cover that we should have?
Well, there is one thing, and that is, of course, trying to recruit more men in the profession. I think it's important that people realize that men can be excellent caregivers. We have that sensitive side as well. And nursing is a wonderful profession that I wouldn't, if someone were to ask me now, do you regret that you didn't become an anesthesiologist? I would say no, because of the fact of, the differences that I've been able to make, the people that I've been able to meet, and the lives that I've been able to touch and get that satisfaction from that. So I guess the only other thing, yes, try to encourage more men to go into the profession.
What a great note to end on. Nursing is a wonderful profession for them to consider. Dr. Grant, thank you so much for such a thoughtful conversation today.
Thank you. Thanks for having me.
And that does it for today's episode. The challenges Dr. Grant laid out, building a workforce that truly reflects the patients it serves, strengthening nursing education, and making equity a foundation rather than an afterthought are exactly the kind of work that raises the line in healthcare for all of us. To our listeners, thank you for joining us. I'm Lindsey Smith. Remember to do your part to raise the line and strengthen the healthcare system. We're all in this together.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.